So I get a lot of questions about how urologists make use of MRI for prostate cancer screening. So the way it works is we get an elevated PSA, the blood test that screens for prostate cancer, which raises some concern about the possibility of prostate cancer being present. Then when we get the MRI, there are essentially three things to consider. One, is there a lesion present? Two, what is the grade of lesion and what is the likelihood that it's cancer? And three, where is the lesion? So the first question is just a yes or no. Is there a lesion present? So the second question is, what is the PIRAD score for any lesion? Sometimes there's more than one, so we're obviously going to be concerned with the lesions with a higher number or higher risk for prostate cancer. The lowest number you can get is a 1. The highest number you can get is a 5. 1 is almost certainly not prostate cancer. A 5 is almost certainly going to be prostate cancer. The one caveat to this is you really do need to trust the radiologist who's providing these numbers, as there is some subjectivity and you will notice slight differences in the way that different radiologists will number these lesions. Let's start with what's black and white. A 1 or a 2 is almost certainly not going to be prostate cancer and will not lead to a prostate biopsy. A 4 or 5, on the other hand, is almost certainly going to be prostate cancer or has a fair likelihood. Not only that, a 5 and to a lesser extent a 4 is going to likely represent a higher grade or higher risk prostate cancer. A 3 is where it kind of becomes tricky, and this is where you really need to trust your radiologist. Usually a 3 is unlikely to be a clinically significant prostate cancer, and so if you have a good working relationship with your radiologist and really believe in a very definitive way in this number, it's actually probably reasonable not to biopsy these. So once you've used the PIRAD score to determine if there is going to be a prostate biopsy, then you can do what's called a fusion biopsy, where you take the information from the MRI, identify where the lesion is, and target it. This increases the chance that you're going to detect prostate cancer if it is present.